Hello, everyone. Good evening. Happy Thursday. It is Thursday night. We normally
That's
do these on
right,
Friday.
right.
I'm so excited, everyone. My name is Ted Williams III, and I'm the moderator for tonight's for our health talk discussion on Thursday night. This is our host, Dr. Tonya Roberson, who convenes these wonderful conversations for us. We get all these wonderful experts in the room. So tonight we're talking about COVID-19. Are the kids all right? Are the kids all right? Are they all right, Dr. Roberson?
Yes, they're gonna be.
They're gonna be all right. That's what I'm
Yes,
talking about. I
yes.
love it. So I'm gonna go ahead and turn it over to her for a few moments, and then when she gets done welcoming us, and I'm gonna play a short video for you guys, and then we're gonna hop into our discussion tonight. So, Dr. Roberson, it is all on you.
Hey, good evening and happy Thursday, everyone, again. I am Dr. Tanya Roberson, the chair of the Far South Chicago Coalition's Health and Mental Wellness Committee, and your host for this evening's Health Talk of Thursday. The Far South Chicago Coalition is comprised of caring community leaders, business owners, and residents eager and working together to make a change and to create a thriving community. We are one band, one sound. Together, the Far South Chicago Coalition has created 9 key focus areas that we will concentrate on together to help the Far South Chicago quality of life plan. But we need your help. So please download the link on the screen and fill out our survey to help us complete our quality of life plan. We want to hear from you. The title of our show this evening is COVID-19. Are the kids all right? And parents, family members, school staff, and other trusted adults must take an active role to support our children during COVID-19 so that they can be all right. The pandemic has cut kids off from friends, nutritious school meals, sports, and routines. And with virtual learning and only a few activities outside the home, it's no surprise kids are moving less and snacking more. But there are careful approaches that can help your kids and families be safe. Although COVID-19 is not the only threat to your child's health and well-being, many illnesses and conditions can cause serious problems. Good preventive care and early treatment can save lives. We're in this with you and your family to help your child get care safely. And we're very excited to have some wonderful guests joining us today from Advocates Children Medical Group for a rich conversation full of information for parents and caregivers about COVID-19, children, and keeping our children healthy during the COVID-19 pandemic. Our guest today will examine some of these implications. So I'll turn it over now to our moderator, Mr. Ted Williams, who will introduce.
All right, I'm going to bring our guest on in just one short minute here, but we are going to have a little video, okay? So hang on, class. Now listen, I told you I called you all class because this is class, right? Make sure you like, share, and follow the Far South Coalition's Facebook page. We're going to be right back with you after we watch this short video clip to help you understand the kids need to be okay too. But according to Dr. Roberson, they're going to be just fine. So let's watch this short video clip, and then we'll be right back with our special.
You have to get up now, Harry. You have to get up. Okay? You're not talking to the lady. Okay, good boy.
My name is Rebecca Joseph.
My name is Hiro Nakamura.
My name's Yeliana.
I was born in Atlanta, then moved to Maine, then I moved here.
For one, I love history.
And I like doing sports.
Mom calls me an independent person.
It's a virus that started in China.
And then something happened that it got spread all over the world. And now it's turned into a very serious virus.
Well, my friends told me about it. They're like, oh, have you heard about coronavirus? I was like, no, what's that? And they're like, oh, it's the same kind of like the flu.
After a couple of days, you'll start feeling better, but then it comes back even worse, which it's kind of like a trickster virus.
coronavirus's weakness is soap.
A lot of the people are like, I'll be fine from it, but then they could spread it to other people that could die from it.
Well, I feel like really nervous and stuff.
I feel a little worried.
I feel scared.
I've been feeling a little bit worried.
Partly it feels kind of cool because like I get to live through like something that'll probably be in history. But it's also kind of scary.
It's going to the country so fast, it just scares me. And my grandma, she's on the older side, and we don't want to spread germs to her.
I don't want to get it, and I don't want my family to get it. And I hope they find a cure because it's going to be very hard without a cure.
I'm worried about my family getting infected. If I get infected, then that's trouble for me, yes, but if my family gets infected, that's a worse thing.
I've heard like people with like already medical conditions who already have medical conditions could like it'll be even worse for them, and I have asthma, so that kind of scares me because I have asthma.
The most that I'm worried about is that this will go on for like a long time. Like we're just at the start of it.
Well, usually if I think about it, I would actually start about to cry, so I take a breath, probably look for something to read, then calm myself down.
I just want it to be over with as soon as possible.
Adults should be following the rules and then making sure their kids are following the rules.
I think they're already doing this with trying mixing medicines.
Because what if all of a sudden a new type of plant comes in and scientists use it for a coronavirus vaccine and it works?
They should really help their kids know like what to do.
I feel like they should tell people to wash their hands, which my dad says to my uncle.
I think they just should stay calm, get regular exercises in areas with people, with not a lot of people.
Technically, if they mess something up, we're the next adults, so we have to fix it.
All right, welcome, ladies and gentlemen. Welcome to our Thursday night health talk. And so I am super excited about this discussion. We've got some phenomenal guests with us tonight, and I'm going to go ahead and introduce them to you just now. We have a team of pediatricians, right? I mean, we get the best guests on the show. We don't just get people on, like, oh, I can have kids, or I know some kids, or I'm watching kids. We have experts in the house. Dr. Jeremy Diagle is a board-certified pediatrician. He is the Healthy Active Living Program Medical Director for the Advocate Children's Medical Group on Oak Lawn Pediatrics. So welcome, Dr. Diagle. Thank you for joining us. And your co-host here, I see, right? You guys are awesome. Once again, together, we're going to have fun. I told them they're close. So either they can end up saying the same things or disagreeing. And because they're so close, it's just, I don't know what's going to happen, folks. I can't promise anything. So Dr. Markeita Moore is a board certified pediatrician also. She's a medical director, Advocate Children's Medical Group for Evergreen Pediatrics. So they are local and they are qualified and certified and inspired, I'm sure. So both of you guys, can we just start with a very simple question? We're gonna go through a bunch of things, and I got my folks on the comment section. Make sure you guys throw those comments, like and share. We're gonna be bringing you guys in immediately in this. You're a part of the discussion too, so drop a comment, drop a word, a question, whatever. Let's start with both of you guys. Whoever wants to go first on this one. Let's start with the fundamental question: how is this virus affecting children? Mentally, socially, otherwise. Let's just start there right now. Either one of you can answer that to start us off.
Okay. First, we are vaccinated, And that's, that's why the mask is down, okay, right now.
Okay.
And so as far as what I've been seeing, like in office visits, is that the social aspect has been gone, taken away. So, and that is like a lot of children's, outlet was school or friends or just walking down the street, and then sports too. So seeing them have less outlets has caused a little bit more of boredom, a little bit more of weight gain, I would say, and a little bit more of just withdrawal, just from their family members, even though they're like in the same household.
Yeah, I totally agree with everything she says. I do think that what's important to realize or to think about is, we think as adults how stressful this is for us and how it has been such a big change for us, and you can't even imagine how it's affecting the kids. So it's really important to check in on the kids, just as you would check in with your auntie or your uncle and make sure they're okay. It's important to check in with your children because this has been a lot for them too. They've had a lot taken away from them. I could not imagine having this happen when I was a child, thinking of all the outlets, even simply going to school and how their social lives has been taken away. So we've definitely been seeing a whole lot more mental health problems come up. And as Dr. Moore stated, a whole lot of problems with weight gain has definitely been a big issue. So definitely it's important for parents to check in and get their problems addressed as soon as possible with their pediatricians.
Fantastic. Thank you. So we got comments already. These comments section, they can't even wait until you guys start talking. They got to get involved already. A few hey Jeremy's. Jeremy has a fan club out there, I guess. So
I love it. I love it.
It is what it is. You know what I mean? It is what it is. And so we got you guys, obviously, Miss Consola. I hope I didn't pronounce that incorrectly. So these are her pediatricians. Look at them glowing full of knowledge. Okay, so actually it's so funny because she asked the first question I wanted to ask as well. What about the vaccine? What about children being vaccinated? Can you give us some clarity around that question? Should they be getting vaccinated? If so, when, what ages, that sort of thing?
So currently, the two major vaccines that are out are Pfizer and Moderna. And so Pfizer is authorized for kids or children 16 and above. So currently, any adolescent or child 16 and above can actually get the vaccine. So they should definitely be talking to their doctor about how to get it. There are also currently a lot of studies going on with kids as young as 6 months to kind of get some studies done to figure out what the proper dosage is for them. There's some more data going on that probably will come out more sooner for kids between 12 and 16. So the current timeline that we're being told is that definitely by the fall, hopefully, we'll be able to get kids of 12 and above to be vaccinated. And definitely by the end of the year, we should be able to get kids as young as 6 months vaccinated, as long as the studies show the proper dosage and everything that needs to be done to make sure it's safe and effective for them.
Fantastic. So how does it, because I've read obviously that we have in this country, we obviously have the largest number of cases in the entire world. But in a population of 300 million people, we've got 3.6 million children who've been infected by the virus and 297 children who've died, which I would imagine is a small number, all things considered, and yet still significant, right? Because it's a life. And so when you think about this question, how does the virus affect children? And then how does the vaccine affect children? How is that different from adults?
So as far as the virus, the studies have shown that the virus is normally mostly asymptomatic with children. So definitely there are a lot more asymptomatic infections with children. So those numbers that you spoke of may actually be higher than that. However, with that being said, I do feel, we do know that kids are not affected as badly as adults for the most part. As you said, there's not as many deaths compared to adults. With that being said, we still want to protect our kids because they're going to be around adults and they can definitely spread it to adults who are more at risk for getting very ill from it. In regards to the vaccine, as I said, there are a whole lot of studies being done. Being that the adult vaccine is out, we already have a whole lot of information on what kind of levels of immunity need to be had to protect the kids. And so, the dose that adults get may be different than the dose that kids get. So that's still something that's still going to be being figured out and being researched. So we don't exactly know that. But we do, of course, will recommend for kids to be vaccinated when they're going to be around other people or just in general, just to make sure that we're protecting all the population as a whole.
Dr. Moore, so what about kids playing sports in the pandemic? And I've seen a lot of this In my community, other places, there are a couple of sort of children. I've had 3 children. My kids are 13, they're 15, 13, and 9. And I've seen, a lot of their friends are still involved in activities. One of their friends had a play 2 weeks ago.
Okay.
And I was just like, what in the world is going on? Broadway is shut down, but these schools are doing plays and things. So what about parents wanting to get their kids back in activities like sports? Is that safe?
So that's like a twofold or a trifold question, because sports, they are safe for if you have the right precautions. Like if it's outdoors, which is always better. If it's not like a high contact sport, and so you should still wear a mask. Now, if it's something like gymnastics or if it's cheerleading, then masks are not recommended due to the fact of a choking hazard, or it might get caught. And then like for swimming, obviously, it's not recommended. But with that being said, you still need to have a certain level of trust and safety within that sports team too, that everybody is taking their precautions seriously and not going to infect somebody else on the team, and then the team takes it back home. So that's why masks are still, best, and then outside sports is still best.
Gotcha. Yeah. So I've got Terry Washington Diagle. Says that I have an 8th grader. Yeah, I'm sure there's no relation. I mean, Daigle's not a common name, sir. So I'm like, I'm not gonna go any further and ask who that is, but anyway, I'm sure no relation at all. It says that I have an 8th grader who recently tested positive. So, let me ask both of you this question. This is a sort of $1 million question. What about schools, right? So CPS has moved to go back. No one asked me my opinion. Nobody cares. But in my mind, I'm like, why are we doing this in April? Why don't we just finish the school year out and get ready for the fall, that sort of thing? Are schools safe? What precautions are being taken to protect children in the schools? Can you guys talk about that for a second?
So with CPS, they have sent out numerous. I have 2 kids in CPS. I've gotten a ton of emails about different things that they have implemented. So they said that each classroom has a HEPA filter, is what they said, as far as to like improve ventilation. They stated that they will hire about 400 more custodians too, because they have to do much more, cleaning. And they also have different hand sanitizers there as well. And they have pods too, so that contact tracing is made easy if somebody does become infected. And still they have the 6-foot rule, and then mask, of course, for 2 and up.
Yeah. So yeah, I agree. There's been multiple studies. They've actually did, like with the schools that opened up prior, they've done multiple studies to make sure that all the precautions are being taken. And as long as the precautions are being taken, there's definitely a low likelihood for transmissions in schools. They've actually shown that a lot of the transmissions don't even happen in schools, to be honest. And another extra layer of protection is the teachers and staff getting vaccinated. I've recently read a paper that across the country, up to like 80 to 90% of teachers and staff have gotten fully vaccinated. And so that's something that's going to definitely protect the children to make sure they're not getting exposed or getting the virus.
And then why they started now probably is because due to social and due to like children that have IEPs, like they can't get those type of therapies like at home. And so some of them were really falling, behind as far as learning too. So that's probably why they were going to do this starting now as opposed to starting back in or later in like August.
Gotcha. And I understand that because, I understand, the idea that kids really don't have anything to do. I've got 3 kids at home right now, and it's a full-time battle to keep them off the TV, off the video game, because they're just here, they don't really have a lot of kids they can hang out with and that sort of thing. So I get it. And I get the weight gain that you mentioned, and we've been fighting that. We got a little gym in the basement, got to get the kids, and the kids cannot stand to see me coming. They're like, oh, Dad, we got to work out again. Yes, you have to work out again. Just because we're in quarantine does not mean you can sit around all day. So let me ask you all another question. Travel. Summer vacations are coming up, if you will. What should parents be doing around that?
Crying. No. Seriously, it's like a weird space to like be in. If you're vaccinated, then of course you can travel, but of course kids aren't vaccinated. So if you're like me and have a 7-year-old and a 4-year-old, so your mind is like trying to wonder, what can we do? So the safest mode of like travel is road trips, because it's just you and your family. But then your like risk comes to the bathroom breaks, comes to the pit stops. And so that's where like those risks come from. If you have to fly, if there is some reason why you do have to fly, then they say that you double mask. And that if you're in like a row of like 3 people, or I think they have a space now to where it's 2, that you take turns as far as eating. So like everybody's mask isn't down at the same time. But the best thing would be road trips.
Yeah. And I just a side note, I've not been on a plane in over a year, but I heard they do not pack them in 2 in a row. They're squeezing.
I should know. You know, it sounds good. It sounds good, but they're not. I know.
In theory, you know, they try to, you know what I'm saying?
Right.
They might have people sitting on top of each other now because the demand is so high. You know what I'm saying? Trying to make up for all the money that they missed out on. So what about Dr. Diagle? You know, family gatherings and that sort of thing. I mean, I know, for instance, I took my children horseback riding last week for my daughter's birthday, and a lot of the kids had masks on, and I know we were outside. I told them they didn't have to worry about it, but they were really, really, paranoid. So I guess the question is, when it comes to family gatherings and that sort of thing, like, what's the rule there?
So I think once again, it's important about the location that you're going to do it at. Of course, it's going to be better to do it outside. So definitely wait until there's nice weather. And as I'm sure everyone may have seen, the CDC just recently updated their guidelines for vaccinated people don't have to wear masks outside in small gatherings. So in that situation, you don't have to wear masks. Although for the kids, it may be different if they're not vaccinated. And so it also depends on the risk level or the people that's in the group. So if there's someone at high risk for, getting really sick from COVID, you definitely should take more precautions as far as mask wearing. But if there are low risk people and people that are vaccinated, you definitely can be, a little bit more relaxed in regards to the mask. Other things you can do is to make sure that there's individually prepared food and whatnot. So everybody's not going into the same containers and everything, to make sure everything is clean and sterile for everybody individually. And if you do have to be inside for any reason, making sure there's great ventilation. So opening up windows and just making sure that everyone is just clean about themselves, making sure you have pretty much the Clorox wipes everywhere possible to make sure everybody's wiping after themselves. So it is possible, but still take the proper precautions to make sure. Also, another thing they recommend is that no loud talking or singing and stuff, because, COVID is spread through secretions. And so, although everyone wants to blast their music loud and do all the loud talking, it is recommended to not do that as much, because that's more likely going to spread the virus if someone is infected.
Fantastic. Thank you. So I'm going to hit these comments again, and then we're going to come back to a couple of the topics. But we've got another... We've got a lot of jiggles in this. And a Martha Smith, who I've just learned has a place of honor in Dr. Daigle's life as well. She said, "Hey, my son," I'm going to leave it at that. I'm not going to go in there and embarrass him any further than he already has been embarrassed. But Terry Washington Diagle says, one student that she had tested positive yesterday. She had to quarantine 30 students and 2 teachers. Should the quarantine students get tested if they are not having symptoms?
So they do not have to get tested, but the quarantine would be for 14 days, because if they were exposed, then they will develop symptoms within those first two weeks, and then you can get tested. But if you wanted to go back sooner, you have to get tested at around day 4 or 5, and then you still have to wait for a total of 10 days then, as opposed to the 14 days.
And actually, I'm sorry, is that the same for the vaccine as well? That's a side question for me.
If someone's vaccinated, you mean, as far as them quarantining?
Yes, I've heard you're supposed to quarantine right after you get vaccinated. Is that correct?
Well, you have 2 weeks before your full-time immunity sets. That's after the second dose.
Right.
There's no quarantine period in the vaccination process.
No, I think just whenever they put out the recommendations for vaccinated people, that doesn't actually become it doesn't become like your situation until 2 weeks after the second dose, basically. Okay. So you're fully vaccinated 2 weeks after your second vaccination or your second dose.
Janice Knox has a question. She says, "Can you explain the MIS-C syndrome that can occur in children who've been infected by COVID-19? should parents be concerned about children going back to school, especially those younger than 16? So let's tackle that.
So the MIS-C syndrome is definitely something that we definitely get concerned about with children. It's basically a phenomenon that happens when kids get COVID, where they can get really sick as far as having heart problems actually long term. And so some of the things you'll look for in kids as far as to be concerned, if your child does have COVID, if they start showing a rash or start having signs of like conjunctivitis, like redness to their eyes, if they are having fevers for like over 5 days straight, if they have peeling of their skin, those are things to kind of look out for as far as your child probably should get evaluated. They could potentially have the MIS-C syndrome. So it is something that's very serious and something you should take not take very lightly when it comes to the child showing any of those symptoms if they have tested positive for COVID. As far as the question, should parents be concerned about children going back to school, especially those younger than 16? So as we spoke about earlier, it depends on, I would just make sure you're in contact with the schools about what kind of precautions they're taking. I think that's what I always tell parents. You need to be in contact and understand what precautions are being taken to make sure that they're safe as far as going back to school. As I stated earlier, also, the teachers are being vaccinated also, which is giving the children that protection. And so, everyone's different. And of course, if your child has chronic issues, that's a different story. So if your child has something that will put them at risk for getting really sick from COVID, that's maybe a reason to not send your child back to school until they get vaccinated, because, they're at risk for getting really sick. If they have things like asthma, diabetes, actually obesity is actually a high risk factor for children. And so that's just something to take into consideration.
And then also make sure that your child has a level of control, because you know what your child will do and will not do as far as keeping their like mask on. So you have to keep that on them. And as far as not sharing food, and just know that they wash hands too. So they have a level of control that they have to do as well.
Okay, I always, I kind of vacillate between sort of this academic conversation and keeping it real. So I got to keep it real with y'all.
Okay, come on.
I'll go back to being academic in a second.
Okay.
How you keep these masks on these kids is the question. That's what I'm trying to figure out. I mean, you can barely keep them on adults.
So one thing I've talked to my patients about, especially with kids, as far as with play and stuff. So with their toys, have them actually play with their toys and put the mask on their toys, or their teddy bears rather, and have them understand it from that perspective. Because so many kids, as far as they love their toys and their teddy bears, and they want to emulate what they do. So you have to start at home practicing basically. And so you can do something like that in order to kind of teach them, oh, well, your baby is wearing the mask, so you should be wearing the mask to protect yourself. And of course, you have to use age-appropriate language on the reasons why. Of course, it's harder with the younger kids. It's recommended for kids above age 2, because we know below 2 is going to be difficult to keep them on. So you definitely should try to make it interactive and make it fun so they can understand. And you really need to start at home practicing before you're taking them out and about, basically. That's just one recommendation I give to parents to kind of help in regards to trying to keep the children to keep the mask on.
Yeah, I would love to hear from our audience members, those who are teachers, how that works for you and how you have been effective in that. We have a lot of comments, so y'all could calm down on the comments. I do have questions myself, and y'all just like, I feel like everybody y'all calm down, okay? I know y'all love these doctors. I know they're very popular, but we're gonna give me a second, and I'll get back to your questions. So let's talk about mental health for a second. We've not talked a lot about mental health. So what about all the kids who are not infected, who are just sitting in the house, separated from their friends for a year? You mentioned, Dr. Diagle, that you couldn't imagine this as a child. I think the same thing. I cannot imagine sitting in the house for a year. How has this impacted our children's mental health, and what can we do to mitigate the impact of this?
So yeah, it's basically going to be pertinent to really keep an eye and check in on your children. And just also notice if there's any changes, because that could be signs of something going on that you need to address. And what I mean by changes is if their sleep patterns are changing, if they're being more defiant or being more aggressive, if they're eating differently or not eating at all, just any kind of changes in their activity that's not the norm for them, where it's like, this is not my child. You need to definitely be talking to your children and having open-ended questions to them, asking them, so what's going on? How are you feeling? I think it's just as you check in, like I said, with your elders, you should check in with your children. And then making sure that they understand in age-appropriate language about what's going on, because you should never tell your children false, truths or just any kind of false information to make them feel okay whatever's going on, you should be open and honest with them about COVID and why it's affecting people and why it's important to take the precautions that we're taking and why some of these things that they're used to has been taken away from them. So to me, it's all about communication. And if there are any signs that you're concerned about with the child being depressed or being more to themselves, you should get it addressed right away. There's so much telehealth and so much telemedicine going on now since the pandemic. And so it's a whole lot easier to find a counselor, you know, to do like virtual visits or to do phone visits. And also following up with and checking in with your pediatrician to find out those resources, because we definitely have a whole lot more resources now because of these issues that have come up. So the end of the story is checking with your child. If you notice any changes, address it right away.
Dr. Moore, you want to hop on this question?
No, so it's just you have to be in tune because everybody is stressed because we don't have any type of guidance right now because nobody's lived in the pandemic before. So there isn't like a rule book for like the first time pregnant person or somebody's getting married or this was their 8th grade graduation. Like this is like a lot to like take in. And so there's a period of adjustment and then there's a period to where you have to see, hey, are we trying to like develop new habits as far as new things like to do? Do we go for walks? Do we just eat dinner like together and like actually have a conversation? It's like trying to like pull out pieces, you know, from the child because they just like to shut down sometimes.
Yeah, and so speaking of being pregnant, what about, you know, getting the vaccine if someone is pregnant or breastfeeding?
So it's safe for pregnant and breastfeeding women. They've seen the antibodies transfer to the baby when the mom got the vaccine, the 3rd trimester, basically. Okay. And the baby was born with antibodies, and with the breast milk, it'll still pass through because of the IgA antibodies that kind of pass through the breast milk.
Gotcha.
Yeah, they just actually released like some study information that they actually did on pregnant women, and it's definitely very safe and effective. They didn't find any severe adverse reactions, and like I said, for breastfeeding people, it's definitely still recommended to get vaccinated.
Okay, good. Okay, let me go back to these comments. So Chinelo Okafor says, agreed. The important thing is MIS-C syndrome happens after a child has already had COVID-19.
Yeah.
Right. And Oyinkansola says that some of my younger patients have brought concerns of getting the vaccine because of changes to the menstruation. Is this a permanent change, or how do I address these concerns?
So I'm not sure if it's a permanent
something
change.
Just happened here? Did I miss something? Did something just happen here? No, I'm sorry. I thought.
Oh, you laughing at me? Oh.
I thought you know, it's so funny how human beings are. We always think somebody's talking about us. Isn't that weird? We always like, oh, they talking about me. Like, oh. They're like, oh, in my mind, you guys were saying I had messed up these names. That's it. In my mind, in my mind, you all were really sitting there laughing like he just butchered their name.
No, we're having our brother and sister banter. That's how we do.
That's so. But isn't that funny how we are? See, that's a whole other show. Like. A whole show called It Ain't About You, you know, mental health and narcissism, you know what I mean? So,
right.
Anyway, so menstruation, right? Changes to the menstruation, she says. She's brought concerns. Is this a permanent change? And how do you address their concerns? Now, I'm assuming this is a doctor colleague here, and because she's talking about patients. So, can you address that question for us?
So, from what I know, that some people have they have said that they have heavier periods after the vaccination. So that is a concern. And they are still, researching that because they're trying to see if the vaccine for these amount of women did cause a heavier flow, or did stress play like any role into that as well? Because stress can also change like a woman's flow. And as far as if it's permanent, I haven't, I'm actually not sure because it's still going on. So I will say that I'm not sure. Okay. To be honest.
So you mentioned something that I just have to ask, and please don't. I mean, you're not gonna be upset with me for asking this question. I hope not. And if you do, I mean, what can we do? We're on the air, so it is what it is. So you said the phrase, Dr. Moore, they're still researching that, and that is sort of the question that's out there about this vaccine that a lot of people are like, wait a second, it came quickly. They're still researching. They haven't had the time to sort of. I need you all to talk to us to allay the fears and concerns of people who are saying they're still researching this vaccine?
Yeah. I think that the best way, or the best way I kind of process it in my mind, is this is something that's brand new for everyone. You know, it's new for, we've never seen anything like this. I honestly, for me, even when this started happening last year, you know, we read about pandemics in our medical school books, but we never anticipated we'd go through this, you know? And so the easiest way I can say it is if, you know, just like you have a new baby and you don't know anything about the baby until as the baby grows, this is pretty much like I mean, I hate calling COVID a baby, but it's like a new baby that we know nothing about. And the only way that we're going to know things about is as time passes and as we learn more and more. Just like when your baby is first born, a year later, the baby is totally different from when they're first born. So what we know now from a year ago is totally different. And so there's going to be a lot of that's why there's constant research going on for us to understand, you know, even when it comes to, for example, how long the immunity lasts for the vaccine, that's still something that's being studied because we just started really giving out the vaccine nationwide. And so we are only not even 6 months from when people first started getting it for us to know if it even holds that long protection. So that's the best way I can explain it. You know, it's just like it's something so new, even for doctors. And so we're trying to learn everything we can in real time as we're, you know, putting out the information. With that being said, we would not do anything or put anything out that's unsafe for people. As we learned clearly with the Johnson & Johnson vaccine, as soon as we saw that something was going wrong that we weren't sure about, we put a stop to it. And that's what I think is important for everyone to understand. It's like we wouldn't put something out, or doctors or just scientists in general wouldn't put anybody at risk when it comes to this. We're all nervous, we're all scared, we're all learning. So just as you have your anxiety about it, we have our anxieties about it also. But I hope everyone understands that everyone's health is what's the number one priority. So just as they stopped the Johnson & Johnson when we didn't know, if anything else happens that's unsafe for people, we're going to do the same thing.
Agreed. So basically what he said with the, you know, with the research, now some people might think that like the vaccine just came out of thin air. Like some office or some research, you know, facilities have been working on mRNA types of vaccines. This is not the first COVID strand. There's been MERS COVID, you know, so COVID is not like a new type of virus. It's just a new mutant type of COVID. So some things was already known, which makes it easier to develop a vaccine. And then anytime that we would do that, there is like a 3-stage process that they have to do. So first they have to study safety. That's phase 1. Phase 2 would be efficacy. And then phase 3 is when you can do like a blind trial on actual people. So there's always safety first with medicine.
Thank you so much for that. Katina Jolivet Gabriel says, it was, thank you. I'm sorry. It was said that if we've been vaccinated already, we have to be vaccinated again in 6 months. Is there some truth to this? I think you guys just kind of answered that question, but I don't know if you wanted to say anything else about that.
Yeah, and so we're not 100% sure when people need to get revaccinated. It has been pretty much said with almost certainty, it's almost a lot of certainty that this is going to be something similar to the flu, as far as where you're going to have to get a yearly COVID vaccine, just like you get a yearly flu vaccine, because there's different variants and strains that come out that we need to make sure we're protected against. So as of right now, we're not 100% sure when you have to get revaccinated. Most likely you will, but the studies are still being done about how long we're actually immune to it, even with getting our first set of vaccinations. And so we're not 100% sure. We already know that it lasts at least 6 months. That's what we know. But as we already stated, you know, there's still research being done to see exactly how long that's going to be, because we're basically only 6 months away from when people first started getting the vaccine. So that's most data we have. So as we get further out, they'll be able to say 9 months protection or 12 months protection, et cetera, to be able to tell us when we need to get revaccinated or basically get like more immunity to it again.
Gotcha. Oyinkansola says, thank you so much for the answers and the honesty. It's great to see doctors state that we are all in this together and we are all learning together. Let me show you all this. Ooh, bam, there we go. We can just throw it up on the screen. You see, we get a little fancy. Right out to here, you know what I mean? It's, you know, we are top of the line.
I see.
On our show. Yes. So what do you guys, you know, if you wanted to just pass one message to people who are listening that you thought just was important for people to know, what would you want the public to know about children specifically and their physical, mental, social health during this time?
One thing or important things that I would say is that don't dismiss their feelings, even if they're 3 or 4, because nobody has been left unaffected by this, and to really consider the stress that you're in and they are in too. So sometimes we have to take a moment and just decompress, and it's kind of hard if you've been homebound. So one more thing is for the parents to find time to just have their own peace of mind for at least 5 minutes per like day, because you've been with this child, you're a lovely child, you know, all day long, and you need to have patience, and we can't get that if we don't have peace also.
Can you say that again? Can you say that again? Can you say it again? For the people in the back of the room.
It's hard, but it's doable. So mine is like 5 minutes in the morning if I wake up early enough. That's my 5 minutes. It's either sleep or my 5 minutes of quiet peace, and you gotta choose.
So you're saying it is possible to love your child, but need some time away from your child for
absolutely.
Your own
that's how you keep up.
So that you don't. Yeah. So you're a good parent, and you exactly. Okay. Cool. All right. So let's see. Did you want to respond to that, Dr. Diagle?
Yeah, I was just going to say, I think that another point to bring up with kids is that kids like routine. And so I think that it's going to be important to kind of establish a routine for them in order to make them, you know, try to make it as normal as possible. Because I feel like if you have routine around the child, they're going to be able to not be as stressed because they know what to expect. Because with COVID, it's so much unexpected. So if you can give them as much information of what to expect, how much whatever they can control, I think that will help a whole lot with their mental health, being that so much is out of their control also. So have the conversations with the kids and give them as much control as possible about what they want to do as their outlet. Do they want to go outside for a walk? Do they want to read a book? Do they want to color? You know, try to get different activities and just, like I say, a routine of how, and let them have the control as much as possible to make sure that they are, you know, staying in a good mental space.
Okay, here's another question. And I was going to continue. I hate to bring this up again. I was going to continue to talk about it. We got another Diagle in the house. I was going to joke about that, but then see, this is why you don't mess with people. Because then I found it in the comments. My uncle pops up on the comment section. And so hi, Uncle Lee. And I was like, you know, I shouldn't throw stones at you because now my people are. Thank you. And he's able to answer COVID questions as well. So yes, of course. So we got this question from Troy Diagle. Will the federal government be paying for this for years to come? That's a very good question, a very important question. How will we deal with this and how will we pay for it? You know, the president was on last night talking about this commitment to invest in vaccinations. He really laid out this vision that he wants the United States to be sort of a hub for the world and sort of be able to get vaccinations out to the rest of the world, because there are a lot of countries that are struggling. India heavily right now is really, in fact, we have a travel advisory against India, which is crazy because we have more cases, but whatever. So, you know, I guess we'll step into the political realm for a second. I don't know if you guys want to. And don't blame me because Troy.
My dad.
You can just mute him and just cut him out. You know what I mean? Look, just private chat me. Any relatives you do not want to just tell me and I'll cut them out. All right. So what do you all think about that question?
So it's like long term. Of course, the federal government will be paying for this for like years to come, because to supply the whole world or the USA with vaccines is going to be costly. Now, where is this cost going to come from? Because clearly it's taxpayers' money with that. And how are they going to cover this deficit is going to be something that is what we have to look forward to, and something that we'll probably have a big hand in.
Yeah. And I will,
I'm sorry. Unlike Amazon CEOs and people like that, it'll be us that'll probably be paying for this for the years to come.
Yeah, absolutely.
Yeah, I totally agree. But I do think that also with the tide changing as far as us being able to get vaccinated to get prevent it, you know, the insurance companies are going to start charging more to their clients as far as when it comes to COVID, because we know how to prevent it now. And so, you know, there are already talks of insurance companies are going to start charging for COVID related problems, although they haven't done so for the past year, because you can get vaccinated and prevent yourself from getting it now. And so that will be a change that's going to be happening in the upcoming months, where the federal government will not be covering as much. as they are right now. And so that's just something to be mindful of also.
That's a very scary thought, honestly. I mean, because, obviously not to get into this whole kind of healthcare conversation, federal government, et cetera, but this is still, the healthcare business is primarily still for profit, last time I checked. And so when you look at these insurance companies, to your point, that's a scary thought that they will be covering less. So that we, I guess the pressure is on for vaccination. What do you guys think about this sort of vaccine sort of passport situation? The pass. I know that they were doing the electronic. They've been doing the electronic monitoring in China really since almost the beginning of this pandemic. Where if you want to go to a restaurant, you have to have your vaccine passport, that sort of thing. I actually heard, I was in another conversation earlier today where I read there's actually now a burgeoning black market for like these vaccine passes and passports, and people trying to lie about whether they, are vaccinated, that sort of thing. We got a few minutes. What do you guys think? What do y'all think about that? I mean, do you think? I guess the simple question is, do you anticipate a time where we're going to have to do that? And what do you think about that?
So I absolutely think, I feel like with COVID, we have to think of the new normal. We're in a new world. And so I absolutely think it's probably going to get to a point to where we're going to have to show a COVID vaccine passport because that's the only way that, these companies are going to be able to be liable to make sure that people are protected. I just saw today on the news that they're going to start having cruises again this summer. And the only way you can go on a cruise is for you to be able to show a COVID vaccine because they want like 95% of the people to be vaccinated that get on the cruise. So, something like that. And so there's definitely, I personally feel like it will come a time where we will have to show that we got our COVID vaccine. I think Chicago's in the process of actually coming up with a passport or something of that nature to be able to show, because I feel like when you go into restaurants, it's pretty much just like pulling up your phone to show something, basically to show like your boarding pass. You're going to have to pull up your phone to show like you have gotten vaccinated because that's the only way. And you're right. There's definitely a lot of people that it's a black market. That's why people need to be careful about even posting their COVID vaccine cards and stuff. So you need to be very careful about that because people can steal your information and actually make it seem like they got vaccinated. There's also been instances where people actually are stealing other people's appointments because they got the first vaccination. So they posted it. Somebody actually took a picture and showed up to their appointment or whatever to get their vaccine. So it's a whole lot of mess going on.
Right.
What in the world? Wow.
Yeah. They find a way. And even jobs are like taking inventory or taking polls of who got the vaccine. So it might affect that as well.
Wow, I never would have even anticipated that or even thought about that.
Just get vaccinated. That's just all it boils down to.
At the end of the day, it's just real simple. Just get vaccinated.
Just get vaccinated.
Okay. But back to our original point of conversation. If I get vaccinated, which I'm not yet, by the way, I actually was going to go today.
But what happened?
And
what happened?
Okay. That's all the time we have for tonight. Thank you guys for joining us. We'll see the doctors later, and good night. It's a long story, doctors. I'll come in for a session with you afterwards, but I'm going to. But so I get vaccinated. My wife gets vaccinated. My wife's worried. She's got allergies and stuff like that. So she's kind of concerned, but we're going to do it. But the point is, we get vaccinated and our kids are not vaccinated.
Yeah.
Explain to me. Talk to me. Tell me something.
Well, you can speak from that. From that experience.
So my boys, obviously, because they're 7 and 4, they are not vaccinated. But with us being vaccinated and their grandparents being vaccinated, their aunts and uncles being vaccinated, it still lets us have a sense of family time where they can still spend time with their grandparents. Now, with their pod, they don't go to school. They just stay at home. So they are remote learning now. So they can be safe around family. But if they're outside or in public, they wear their mask, or if their cousin comes over who is still not vaccinated and they go to school, then they wear like their mask. And I tell them until they get a shot, they have to wear this mask. And my 4-year-old, after like 2 hours, was like, can you give me the shot now? I was like, no, baby, I cannot.
Because for a 4-year-old, it's torture. I mean, you would have a shot than a torture wearing a mask.
I was like, you want the shot? He said, yeah. But the 7-year-old was like, mask up. He was like, I'm not getting the shot. But
so I know we kind of talked about this a little bit, but just refresh my memory. When do you think these kids are going to be able to be vaccinated? By the fall, by the end of the year? When will we be able to safely kind of, have the kids at the same level or similar level of vaccination as the adults are?
Well, as he mentioned earlier, I'm thinking that between 12 and 15 will happen soon. Now, the next stage might be from 6-year-old to 12-year-old. But as far as for like all the kids, I would probably say by next spring, for the 6 months to the 6-year-olds, because we might get down to just the 6 through 12, which is basically school age if you go down to about 5 years old maybe. But I just don't know if they'll do like infants yet this year.
Yeah, it's going to come in cohorts. I mean, they've already shown some promising studies with 12 and above. So we definitely anticipate by fall, the 12-year-old and above will be able to get vaccinated. But it's definitely going to be in groups and stuff. And as Dr. Okafor says, it's even more effective. So yeah, so I agree. Yeah, definitely by the end of the year, 6 and above, and we'll see about the 6-month-olds. I mean, in my mind, I'm hopeful by the end of the year, everyone will be able to get vaccinated.
Right,
I'm trying to be hopeful.
Interesting.
A vaccinated Christmas.
So, yeah.
Right.
You know, I write plays. I'm gonna have to.
That's Markeita, MAR.
That's what I said there, because I promise, if you see that come out, she'll show up at that theater like, "Where my money at, dog?" You know what I mean? She's gonna sue me.
She will. She definitely will. She's all about the.
So anyway, so some preliminary results have shown that the COVID-19 vaccine is even more effective for younger kids. They're still researching this also. Uncle Lee Kid says fake color test. So I think he was talking about this whole passport question and where we are on this. We've got some comments. Katina Gabriel, good question. And we've just got some wonderful comments. So, ladies and gentlemen, we're going to wrap this thing up here in about a minute or two. And so I've really enjoyed this. And I really have. You know, we've learned a lot tonight, but we had some fun too. You know, these guys here are awesome. And of course, we had I'm not going to say it. I'm not even going to mess with you one more time, but I'm just going to say some people get a lot of support, and that's a beautiful thing. It is a beautiful thing. So what do you guys want to say to our guests, our audience in closing?
Get vaccinated.
Yes.
Get vaccinated. I just think that that's the most important thing right now, you know, getting vaccinated to protect yourself and the kids, because that's the only way that we're going to be able to make sure they're protected also. You know, there are side effects to the vaccine. There are side effects to a lot of things in life. And so I just feel like, you know, it's important for people to get vaccinated, understand that we're here to make sure everyone's protected and safe with getting vaccinated. And the only way we're going to get back to some type of normalcy is for people to get vaccinated. And I don't know about y'all, but I'm tired of wearing this mask. I'm tired of all the precautions. And so I hope that everyone doesn't want to be wearing masks for the rest of their lives. And so the only way we'll be able to get back to some normalcy is for everyone to get vaccinated.
Yep. Say that again. Dr. Moore.
Well, he basically said everything.
I'm gonna charge her for that.
Well, you can charge her, but she can be charging me for this new play I'm right now.
But I'm played it. No. But so as far as it goes, as far as just in like summary, vaccinations is important. If you're hesitant, I can respect that because this is brand new and you're nervous. So just reach out to your physician. You can Google what you need to Google, but we have to still reach out to the people that have spent their lives in school studying this and who do want the best for you too. So trust your doctor. And if you don't trust your doctor, you need to find a new doctor that you do trust. And then ask them what their thoughts are. Okay. And to get vaccinated, because we want to have a vaccinated Christmas.
Right.
And we just want to play.
I got the whole show planned out already. I got the whole, and you guys are dropping these gems. You know, I got quotes from you all. If you tired of these masks, get vaccinated. I got that one. And what did you just say? You just said something. Dr. Moore, I just lost it. You just said something that was significant here.
Oh, if you don't trust your doctor, get another time. You better trust these people. We have to have a relationship to where, because we don't judge people. We don't have any right to judge anybody's fear or anything. We're just there for you just to get what we've learned with what we want to share.
Absolutely. Thank you, guys. Thank you. You guys are fantastic. Dr. Roberson, we've had a wonderful time tonight. Yes. Been great. Thank you guys for watching us. I'm going to turn this over to Dr. Roberson to close us out. But I hope that you guys learned something. I hope that you were inspired tonight. I hope you enjoyed this discussion. And I do hope that we make the right decisions about our health and our children's health because our lives and our communities depend on it. And I don't know about you guys, but those of us who are not vaccinated yet, which are maybe few, and I'm more inspired at this time. So thank you guys very much. Thank you so much.
Thank you. Well, that concludes our Thursday Health Talk of this evening. This was an excellent show, and I want to give a special thanks to our awesome guests, Dr. Jeremy Diagle and Dr. Markeita Moore, for the great information that they shared to help us make sure that our kids are okay. We are very grateful for your experience and your knowledge, and we will definitely have to have you back. And everyone, please don't delay important health care for your child, including all of the important immunizations, including COVID-19 vaccine. If your situation seems too hard or you're worried about your child's overall health in the past year, seek help and see how your pediatrician can help. I'd like to also thank our faithful listeners for tuning in today. And listeners, remember that we want to hear from you. We want to invite all of our guests to contact the Far South Chicago Coalition. If you have been influenced by our show or if you have any questions or comments, please call us, visit our Facebook page, like us, comment about this Facebook Live, and request a show topic that you would like to learn more about. And last but not least, take our survey and help us to develop our quality of life plan. This show is sponsored by the Health and Mental Wellness Committee of the Far South Chicago Coalition, which is spearheaded by our president, Dr. Joyce Chapman. And this show was directed and the content was produced by Dr. Tonya Roberson, and a job well done by our moderator, Mr. Ted Williams. See you all tomorrow for our regular Friday Health Talk of the Week. Have a good evening.